So most people think the Affordable Care Act is really about expanding health care coverage for those folks who don't have it today. And that really is the heart of the law, but in that law are enormous important opportunities to improve long-term services and supports for a whole range of folks. The Affordable Care Act offers states new opportunities to improve their Medicaid programs in a number of ways. These include opportunities such as improving personal care attendance of services in the community to help people stay at home, helping individuals who are currently living in nursing homes move back into the community. One of the really important concepts that the Affordable Care Act advances is the need to support family caregivers. Now, what makes long-term services and supports different in many ways than acute care delivery is that the family plays such a critical role in the ongoing lives of individuals. It's not just about the short time in the hospital, it's about how you live your life every day. And families are so attuned to the specific needs of their loved ones. The Affordable Care Act offers tremendous opportunities and recognizes opportunities to support these families. Embedded in the ACA are two very important opportunities to fundamentally reshape how the acute care delivery system interacts with the larger set of needs that people have as they age. The first opportunity is the Medicare and Medicaid Coordination Office, which focuses on those individuals who are commonly called dual eligibles, folks who have Medicaid and Medicare. So at their inception, the Medicare and Medicaid programs were really built to be independent of one another for the most part. Medicare focusing on older individuals and Medicaid being the primary source of coverage for those who are poor with medical needs. What's really important over time is that for older individuals with serious medical problems who are poor, those programs come together in provision of their care, but they still operate very, very independently. So what's important here is that the Office of Coordination will allow these programs to serve in a more seamless way and to help individuals receive better care coordination. The other really important opportunity is the Innovation Center. And the Innovation Center offers all of us the opportunity to test brand new models, particularly community-oriented models, that look at ways to improve care through care coordination, through the creation of medical homes, and with a real focus on community-based services as opposed to institutionally based services. Within the Affordable Care Act is a unique program called the Community Living Assistance Services and Supports Program, otherwise known as the CLASS Act, which was specifically meant to help fill an important gap. It is a voluntary, long-term care insurance program where people would contribute while they're working for a period of years, which they could then access should they develop long-term services and supports needs. It's unlike anything that we've had in the country before because it actually provides folks a cash benefit when they need it, which they can use to purchase long-term services and supports in their homes, or it could pay a portion of what it would cost to go to a skilled nursing facility should they need that level of care. At this juncture, the CLASS program faces some significant challenges because you've got to build a program that's actuarially sound, meaning that it will stand up over time and that it will be there for folks. And on the other hand, it's got to be marketable. People need to be able to want it and purchase it. A lot of work is being done to assess whether we can get to that kind of a product. But the concept, the underlying concept in CLASS is what is so important.